Welcome back to our YouTube channel. My name is Dr. Valerie Carly. Today's case, we have here Chibiba. She has a swollen high limb, as you guys can see. And there's a couple of things that come to our mind whenever we see a swollen high limb. First of all, we think about progression. When did this started? How did this started? What have the owners done in the past? If they had treated it, tried to treat it, any diagnostics, etc. So Chibiba has had this issue for a couple of years already. She has been treated in the past for it. And there's 3 differential diagnoses that come to my mind when it's not something that it was caused to a traumatic event. So if it's not something that she hurt herself in a traumatic event, then there's 3 diagnostics that I absolutely have in the back of my mind. The first of all, which is one of the most that we see often on horses, is cellulitis. Cellulitis is an infection on the underlying tissues of that limb. And cellulitis can cause a lot of pain, a lot of discomfort. It can cause lameness, and then the swelling, pitting edema. It can be warm. It can be a little bit harmful when I touch her. Therefore, we want to rule out that from other things such as vasculitis and lymphangitis. So vasculitis is basically a disruption of the vessel walls. And what that disruption causes is that there's not a good drainage on that limb, and it can cause inflammation of the vessels. So the causes for a vasculitis, it could be a couple of reasons. That vessel wall is disrupted due to, it could be immune mediated, it could be infectious, it could be traumatic, it could be a toxin. Therefore, that's one of the ones that comes into my mind as well. The other one would be lymphangitis. Lymphangitis, such as lymphatic vessels. Those lymphatic vessels can also be disrupted and cause decrease on the circulation of those vessels, and then cause inflammation, and causes for that could also be traumatic, or it could be idiopathic, meaning we don't know why. So the first thing that we want to do is a quick physical examination, a lameness evaluation. This patient, thankfully, is not lame and she's not in pain. She's pretty comfortable with her limb being that swollen. Therefore, the first thing that we do after doing that physical examination is doing diagnostics to be able to rule out what, the difference in the differentials. Right now, we did CBC, chemistry, SAA for Chibiba to be able to rule out her diagnosis. Her CBC, everything was normal. What are we analyzing there? We're analyzing white blood cell count. If it's elevated, then it can indicate an infection, inflammation. Hers is normal, so what that means is we're not dealing with an infection. Her SAA, serum amyloid A, also measures inflammation. She was within normal limits. That also indicates that she's not dealing with a severe infection. Good diagnosis for her. Chemistry. Why are we doing a chemistry? We're doing a chemistry for liver values, kidney values, just to make sure that the organ function is functioning correctly. Everything is normal. So what that means is we can do a really good intensive treatment plan on her to give her medications to reduce that inflammation of the limb. That's the importance of diagnostics. So right now what we're gonna do on her, since we already did all her diagnostics, we're gonna put a sweat bandage on her, which is gonna help that limb sweat and start reducing inflammation. The other thing is we're gonna start her on IV therapy for anti-inflammatories, for diuretics, and if necessary, antibiotics. That it's probably highly likely that we're not gonna do that on her at this moment. And then therapies that she's gonna get daily here, she's gonna do MagnaWave. She's gonna do the cold water spa. The cold water spa has a lot of minerals and electrolytes, and it's really cold, so it's gonna help reduce that swelling, reduce that accumulation of fluid. It's gonna suck out all that fluid. And then we're also gonna have her walking, so we need her to move around to help that drainage. So we're gonna do everything necessary to reduce that the accumulation of fluid there. Depending on what type of diagnosis we're dealing with, lymphangitis or vasculitis could be something that could be recurrent. So we want to do a very aggressive treatment to reduce that inflammation, but she can definitely get that inflammation again. So what are we gonna do? We're gonna teach the owner protocols of management at home after we get this limb reduced in size. We're going to do a sweat bandage on this patient. The first thing that I put is a cream that has a lot of anti-inflammatory properties, and it will help the limb sweat. That's what we want. We want this limb to start sweating, to start reducing the inflammation. We want to dry out all of that accumulation of fluid in there. Suck it out. It already has the cream which has anti-inflammatory properties. Now I'm going to put this because I want the limb to start swaying. With the brown gauze, I would slowly start increasing the pressure. We have to be really careful. Tendons and ligaments on this region, we cannot do it too tight because we can cause issues. But we have to be as tight that we can at least get some support on this limb. Even though this bandage is now for support, we still want it a little bit tight so that we can cause compression for the swelling. Now this bandage is going to be placed there for 24 hours. I'm also going to put a little bit more cream on the top part to also reduce the swelling. Anti-inflammatory properties is everything we want for this case. She's going to have that on. We're going to place a new one tomorrow. We're going to do that every 24 hours to assess the limb, to assess if it's actually reducing in size, to see if we need to do a different treatment protocol. So yeah, that's how you do a sweat bandage. If you think this case is cool and you like videos like this, we post every week educational videos for clients, for vet students. And if you want to see more of that, subscribe to the channel so you can see a little bit more.